Well, good afternoon, everyone. Thank you for joining us for our Medical Reserve Corps new volunteer orientation for COVID-19 response. I am Jennifer Freeland, the State Volunteer Coordinator here at the Virginia Department of Health in the Office of Emergency Preparedness, and I have the pleasure of providing you with our volunteer orientation today. We should take about an hour and a half. We'll have a little time at the end for any questions. If you put those in the chat box, Megan will collect them for us and we'll ask those at the end. But done this enough time now, I pretty much have anticipated most of the questions, and hopefully there won't be very many. So let's go ahead and get started. You are here today because you want to be a member of our Virginia Medical Reserve Corps team that is responding to COVID-19, and we thank you so much for joining us. You hopefully have completed an application in our Virginia Volunteer Health System. If you haven't yet, we're going to talk a little bit about the system. So you should be, because you have an orientation or application, you are invited to this orientation, so you're at step 2. In the background, we are conducting a background investigation for you from the Virginia State Police. There's some training requirements. We'll be assigning you to a team and potentially some roles that you could fill, and then we will deploy you for specific missions to support COVID response. So today we want to give you a basic understanding of what the purpose and mission is of our program. Why are we here? An overview of public health. I'm really going to be very light on that public health overview, but talk more so about emergency response as related to COVID-19. You'll understand your role as a volunteer, responsibilities, protocols, what you should and shouldn't do, how to communicate with us, know how to effectively utilize our Virginia Volunteer Health System and our TRAIN learning management system. And then we'll talk about next steps. So we have a good bit to cover. Let's go ahead and get started. So the Medical Reserve Corps program started after 9/11. There were a lot of people, probably like yourselves, who really wanted to help. And at the time, there was no way to credential and deploy healthcare professionals and community members who were interested in supporting a public health emergency. Primarily at the beginning, the MRC was created to support mass dispensing of anthrax to the entire population very quickly, and our mission has evolved to much broader public health response. We use a system called the Emergency System for the Advanced Registration of Healthcare Professionals. It's required by the federal government, and in Virginia, it's called the Virginia Volunteer Health System. The MRC National Program is a program in the Department of Health and Human Services and Assistant Secretary for Preparedness Response, but in Virginia is a part of the Virginia Department of Health. It is our state's volunteer management program. So we are not a 501c3. We are a government-managed volunteer program. And our mission is to support ongoing public health initiatives and emergencies throughout the Commonwealth. We have a Medical Reserve Corps unit that covers the entire state. And we're very proud of that. Many volunteers for a very long period of time have been working diligently to protect the health of Virginia. I'm going to give you a few little snippets to show you what volunteers have done in the past for public health. We regularly provide health screenings to at-risk, underinsured community members. This is an outreach for homeless individuals in Virginia Beach. We have a large outreach and education teams that go into schools and at community events and provide information about whatever the disease or emergency preparedness messaging needs to be provided to that community. It might be Lyme disease, it might be, prepare and get a kit and a plan. Whatever that is, MRC volunteers are the public health champions of their community, and you are a part of that public health team. To address our opioid epidemic, our MRC volunteers across the state have been supporting drug take-back events where we collect unused medication. We also provide education such as the Revive training and dispense Narcan to our communities. So volunteers are very much engaged in addressing the public health concerns of their health departments and their local communities. You will have the opportunity to do that not only for COVID, but hopefully you become such a member of our team, you continue to be engaged after COVID and can support some activities such as these. In addition to our response with COVID, we're potentially looking at deploying medical volunteers to support the inauguration if there is an outdoor ceremony. I think it's to be determined. But in the past, we've deployed medical volunteers who worked alongside the National Park Service, U.S. public health officers, and others to support medical tents that have been along the National Mall for the inauguration. So we work with our local, state, and federal partners to meet public health and medical needs throughout the Commonwealth of Virginia, and in partnership with the federal partners, even go outside the Commonwealth into DC. So beyond the regular public health, we have 4 main missions for public health emergencies. We coordinate, not provide everything. We coordinate medical, public health, mental health, and emergency medical services. So medical is primarily provided by our hospitals, healthcare systems, primary care physicians, dialysis, all a part of what we call our healthcare coalitions. And public health is VDH and the local health departments. Mental health is provided by the Department of Behavioral Health and Developmental Services and local community services boards. And then the emergency medical services, the broader state level, is in the Office of Emergency Medical Services, which are really managed locally by our local EMS councils. We conduct active disease surveillance and investigations for multiple diseases, but as you can imagine, COVID-19 is our #1 focus. We will start tracking influenza and any other disease as they occur in the Commonwealth. And our Office of Disease and our surveillance and investigation and epidemiology has been very busy. We have some fantastic state employees that have been working very hard for, well over a year for this COVID response. Our Office of Emergency Preparedness is tasked with the challenge of being able to mass dispense either Cipro or Doxy for anthrax or vaccinations, as we'll be doing for COVID, in the event of a public health emergency. So we've practiced it. We practiced it with our drive-through flu clinics. We have done it for H1N1 in the past, which was a pandemic itself. And that will lead us to be very successful for our COVID-19 campaign. And then volunteers also support mass care or shelter operations more in the medical special needs. Our nurses do. We've actually deployed volunteers to North Carolina for Hurricane Florence, and they provided medical care and shelters down there. So the declared public health emergencies, we had H1N1, we've had Ebola, Zika, and our opioid addiction. And volunteers have all had a role and responsibility into each of those response efforts. What I will not be covering today is COVID-19. We're going to focus really on the volunteer aspect of Medical Reserve Corps and not COVID-19 itself. I refer you to our very in-depth COVID website and also the CDC resources that are linked there. And what we also do have some training I'll mention here in a bit. If you haven't already done so, we encourage you to download the COVID Wise app. This allows 2 telephones to be able to notify each other that they have been in the same vicinity of each other for more than 15 minutes when someone that reports on that telephone that they have tested positive. So it's just one more way that we can help with contact tracing, because we've been doing a lot of contact tracing from the very beginning, and supporting our epidemiologists has been a priority. Our public health information campaign has been very robust, as in addition to infection prevention, testing, medical surge, and vaccination. And I'm going to give us some good examples here. So at the beginning, we had MRC volunteers that were answering phone calls from healthcare providers. This is a retired physician who was supporting the epidemiologist. We continue to have volunteers assist with contact tracing and case investigations. Some of those are in-person support efforts. Some of them are virtual support efforts. Many of our volunteers have become case investigators or contact tracers, and actually were so valuable that they were hired as part-time staff by VDH. At the very, very beginning, before we ever had declared emergency for COVID-19 in the Commonwealth, our MRC volunteers staffed call centers. This was the very beginning of which we did not have a social distance or mask requirement. And since the look of our call centers have changed, here we have with no masks, and now we have socially distanced with everybody wearing masks. So we continue in many health districts across the state, MRC volunteers supporting call centers. I would expect that as vaccine is made available, we will receive even more questions from community members about how, when should they receive vaccine. And I expect these call centers will continue to support their community members. And if you have, a half a day and you're like to talk to people and you feel that that's a mission that you would like to support, we welcome you to join one of those teams. In addition to being on the phone, volunteers have literally put feet to the pavement to be messengers by handing out information, distributing masks, walking door to door in communities, and really helping their neighbors understand actions that they can take to prevent the spread of COVID, but how to even go to community testing events. And that's been very, very targeted. And it's a relationship sometimes with our community emergency response teams and our emergency management partners. We also have some virtual volunteer opportunities. We've done some facility PPE, personal protective equipment surveying to make sure that our long-term care facilities and others have the appropriate amount of PPE. We're a little less focused on that now because it seems like, for the most part, inventory supply chains are significantly better than they were in April and May. We have a mental health resiliency team. There is lots of opportunities for online training, such as the one you're completing today. Some unit coordinators have volunteers helping in the Virginia Volunteer Health System, and also with Facebook and Instagram. Many volunteers are supporting as public health screeners. So whether or not it's in the health departments or maybe a county facility, volunteers are at the door making sure that individuals that are coming within the facilities have met all the screening criteria and that they are using effective infection prevention strategies such as wearing a mask and washing their hands or using hand sanitizer. So many volunteers support that role. In addition, we have volunteers that have taught training to other healthcare professionals, our long-term care facilities, on how to properly don and doff personal protective equipment. That was a new concept to some healthcare providers that weren't used to doing that, our CNAs and long-term care facilities. And we really need to focus on keeping our healthcare workforce safe. So that has been a part of our mission. In addition, we have volunteers that are trained to provide N95 fit testing. So an N95 mask must appropriately fit your face and be tested to make sure you can get an effective seal on your mask. And we have rigorous testing standards for that. If you need an N95 mask to serve in a position that it's deemed that PPE is appropriate for, we will ensure that you receive the mask and that you are fit tested for it. And here we have volunteer testing, and other volunteers have provided PPE fit testing to firefighters, healthcare providers, a long list out in the community, other public health staff members. So it's been a good mission for us. And early on, the very first drive-through testing event was in Henrico, and it was staffed 80% by Medical Reserve Corps volunteers. We have worked very hard to provide community testing events in areas where we see the greatest outbreak, and our Spanish-speaking population, African-American population that may have challenges, either health literacy challenges, lack of healthcare access. So we go to them using our community testing events. And maybe you might have known of somebody who's walked into a tent or driven by in a car to get a COVID test from our MRC volunteers and our partners, either the Virginia National Guard or some of our private vendors. I think MACO is one of the private vendors, but often if the MRC volunteers are not doing the testing, volunteers are doing the wraparound services of administration and specimen collection, all of that. So we work together as a larger team to provide community testing. So far, we've done over 520 community testing events for COVID-19. We will continue to support them, although we're seeing a change in our mission to focus more on vaccination. An unexpected mission that we were challenged with in early April was the need to fill very critical emergency workforce gaps in our long-term care facilities. There were several facilities throughout the Commonwealth that were unexpectedly, immediately cut of much of their staff. So it was not uncommon for a long-term care facility to lose 25 to 30 people in one day. And that was nurses, that's, CNAs, that's people who could help make sure their residents were getting food, all of that. And we had some amazing volunteers that stepped up, worked 8 hours in full PPE and helped the residents of these facilities and helped the facilities just to get over the hump of not having enough staff. So really kind of an emergency for a couple days will help you till you can get some contract staff and your people can come back. We've phased that out a little bit more as most of the facilities have obtained staffing. We also, in the past, have provided some support outside of hospitals in a mobile tent. Actually, the testing picture previously of the tent was outside the Centera Obasi Hospital in Suffolk. This is a picture of an exercise that we do every year, working with Centera Princess Anne, where volunteers work with their staff to provide a mobile ED. I hope that we don't have to get there, but it would be a potential that we might provide some type of support, but right now really don't have that in the plans, as we're turning 100% of our attention to mass vaccination. That third priority area, really our #1 mission for the Medical Reserve Corps. And we started with mass vaccinations for school immunizations once we realized that because of the shutdown to delaying elective surgeries, many of the providers limiting patients coming in their facilities, that there were a lot of children that were not up to date on their immunization. So volunteers worked with the health department to provide drive-through school immunization opportunities, and we've improved those numbers significantly. We've also supported flu vaccination events, and this picture is from last year. We annually test our ability to do mass vaccination efforts by practicing using flu vaccination. So the free flu vaccination drive-through events are really an emergency response exercise in disguise. And we are practicing what we will be doing for COVID-19. And we've already done several of those events. I think almost all of them have been accomplished by now. I think we were done in November. And this is another model where people drive through a rescue squad so that volunteers will provide vaccinations and do the screening in the shelter of a rescue squad, which is probably a model we'll be looking at in many areas as we're concerned that we'll be providing a lot of vaccinations here over the winter. So what is COVID-19 vaccination going to look like? We are learning a lot and having to be very flexible and adapt as we learn now that VDH is receiving the Moderna vaccine. I imagine that we probably are having Moderna vaccine delivered as I speak. I think most health districts are expecting it, and there are plans for Medical Reserve Corps volunteers to support a COVID vaccination event tomorrow in some of our health districts across the Commonwealth. So I don't have any pictures yet. Next time I do the orientation, we certainly will. And I encourage you to either view the recording of our COVID-19 vaccination overview so you can learn a little bit more about our point of vaccination operations. And we have a recorded version, and I think the next one live is the 23rd of next month. So it's a lot of work. Not only is the challenge with COVID-19 vaccination a lot of work just to begin with, but it's even more challenging because we have to give the vaccination twice. So it's doubling the workload. And we do not have enough public health staff. There is absolutely no way a local health department could provide all the vaccinations that are required of us, the Commonwealth, to provide to the citizens without Medical Reserve Corps volunteers. We couldn't during H1N1, and we certainly would not be able to do what we have done thus far and will need to be doing in the future without you. We have a limited workforce. Many of you have skills and experience that even our public health staff members don't have, and we need everyone to be a part of our team. We know you're here because you care, and I really say, when people say, what's the number one qualification that you need to have for a volunteer, and I say that you have a heart for public health in your community. So if you're spending your time with me here today, I can probably say with 100% assurance that you're doing it because you care and it's something you feel a call to do. We need to quickly expand capacities so volunteers, it's great to be able to hire people, but sometimes that takes time, and we need people like tomorrow. And MRC volunteers are able to just, fill in those gaps in very short notice. And we need both support and medical volunteers. You can see here, there's a picture of 3 volunteers. Only one of them is medical. A first aid volunteer isn't even a medical volunteer. They just are providing first aid and trained, and the other one's a supervisor, and that does not require a medical. So, a 2-for-1. We need support volunteers, and we need medical volunteers. And we accept any healthcare professional. We have a wonderful veterinarian that I've known for 15, 16 years, and he's been helping with contact tracing. And he's worked flu shots before. And, there's a place for all of our healthcare providers. And we really, we have to be a little willing to cross-train sometimes, but, the skill set that you have as a healthcare provider is very beneficial. We have need for the non-support volunteers. I can't tell you, we love some teachers as we're trying to organize and explain processes to people. We know teachers do that on a daily basis, and they can help to meet those, the challenges of a lot of the different people that will be coming to our point of vaccination sites eventually. We need interpreters. If you speak another language and are willing to help with interpretation or translation, please indicate that on your application in the Virginia Volunteer Health System and let your MRC Unit Coordinator know. We will have interpreters at our point of vaccination sites. Sometimes we give them different armbands if they can speak Spanish, for example, so that they could be pulled aside to assist someone that speak English is their second language. So you bring an extra skill set if you have that. Really, there is something for everyone, and it might be as simple as handing out a sheet of paper and providing people with directions, but every position is very valuable. And we have a very large team. And these numbers are as of November 10th. And we did a very large recruitment campaign. Our state health commissioner, Dr. Oliver, sent out an email to individuals that were licensed in the Department of Health Professions who could vaccinate and who indicated they were interested in doing so as a volunteer. I'm guessing that many of you on this training today are one of those individuals. Well, I didn't have the chance to update this slide, but we're well over 19,200 approved volunteers and 13,000 some deployable volunteers. So I'm just amazed. We started out the beginning of the year with about 7,000 deployable volunteers. So we've increased our capacity by over 5,000 people, and you completing the orientation helps to get more people in that deployable category. We need you to do more than just register. We need you to be credentialed and ready to be mobilized to support the missions that we are tasked with. And of course, that means you're part of a very big team. We have a lot of red shirts. You'll see that our Virginia MRC COVID-19 shirts are a little cardinal burgundy color this year, but many of our MRC units have red shirts that typically is the color. Some have light gray and blue, but our logos are primarily the same. We're part of a big team. So although you might be in one MRC unit, if it's a regional response, you might be volunteering with MRC volunteers from other health districts. And so you'll be one big team together. So I've posted here our map, and if you go around, please identify where you live and who your MRC Unit Coordinator is. Hopefully, if you haven't heard from them, you'll be hearing from them soon. So in Fairfax, we have Paula. Arlington is Christina. Alexandria is Ianella. Prince William is Amy. Rappahannock and Rappahannock-Rapidan is Jessica. In Henrico and Chickahominy is Alyssa, and Richmond City is Kate. They kind of tag team together. Three Rivers, we have Johanna. Eastern Shore is Ellen. Peninsula is Olivia. Norfolk is Summer. Portsmouth is Terry. Ellen Burgess is in Virginia Beach. Tom is in Chesapeake. Connor is in Western Tidewater. Augustine is in Chesterfield, and in South Central, it's actually Tanisha for the moment. Near Southwest is Mary Lou, and then the Southwest MRC is Christina. So, oh, I forgot, Chris is up there in the Northwest. He has a big portion of the state up there in Orange as well. So know who your coordinator is. We have contact information on our website. If you don't know their contact information, it's there as well. So let's talk about expectations we have as far as you being a member of our team. Please do not self-deploy. So just because you see a news feature on the MRC about volunteers giving vaccinations, perhaps supporting a hospital or at a community event, it doesn't mean that you are needed for that event. So please just don't show up and say, here, I'm here to help. We will communicate with you when you're needed and where you're needed. So don't go unless we ask. Make sure that you complete the required training, because that's going to help us to mobilize you and place you in positions where you're needed the most. Respond to alert notifications in VBHS. I'm going to show you how to do that. But I'm gonna warn you, if you don't respond, the MRC Unit Coordinator sometimes will resend the alert. So not responding means that you might get the alert again. Please be dependable. You know, we understand things happen, you know, life situations happen. If you can't come, please let us know so that we can, you know, reorganize our staffing and make sure we can continue to support the operations that we're asked for. Maintain current contact information. As you can imagine, you saw all those red shirts in the previous picture and the 19,000 people on the Virginia MRC Rolodex. Like, that's a lot of contact information to keep current. So please help us with that. And I'm going to show you how to access your information in the Virginia Volunteer Health System. Be committed when you make the commitment, and always know you are representing the Virginia Department of Health and the Medical Reserve Corps. We encourage our volunteers to always represent us well. And we have had many volunteers that have been interviewed by the media and have actually been interviewed on Dateline NBC News, national media. So the MRC has received a lot of press. And we're grateful for that, and we'd be more than happy to facilitate you being interviewed, but that has to be done through our office. If you're at a live event, such as a point of vaccination, there should be a public information officer there, so please refer to your supervisor that you're assigned if the media were to approach you. If you're not on site, please contact your MRC Unit Coordinator. I just reviewed an article from a MRC volunteer that they wrote and provide a little bit of feedback, and it'll get published. So when in doubt, please ask. We would like to make sure that the MRC is in the right spotlight, that the information that we all provide is accurate, and it requires a teamwork to do that. Pass the slide. Okay, this is a really important one. That's why it's all in red, bold, and italicized. Okay, don't go unless we ask. If you go without us asking you to go, we'll have to remove you as an MRC volunteer. We are very fortunate that volunteers are provided with the Commonwealth's liability coverage, but that is only available to you if you are mobilized by us. So don't go unless we ask. Sorry, I keep double clicking, apologize. So we have, of course, all of us are expected to follow the Health Insurance Portability and Accountability Act. It requires that all of us secure the information of our patients and clients. And when you submitted your application in the Virginia Volunteer Health System, you had to acknowledge that you would comply by HIPAA. And so if you would like to review that document, it is posted on the orientation page where you got information about this training. I refer you to go look at that and refer back to it. But even that you saw someone that you knew in high school that drove through in a car for a vaccination event, the fact that they were there is personal, identifiable information, and you can't share that with your family that you saw somebody at a clinic and that they were getting their COVID shot. So, it can be very simple, but we all must be mindful. We are provided with the same liability coverage that any Commonwealth of Virginia employee is provided with. And we are fortunate for that. They're covered by the Commonwealth's risk management policy, the Secretary of Treasury's Division of Risk Management manages any claims regarding MRC volunteers and VDH staff. I have compiled, with the support of the Attorney General's office, a long list of all of the liability coverages that are provided in a pandemic. Anything related to volunteerism in the Commonwealth, you can go to the website and look at that there. So following instructions, deploying when we're asked, doing things within the scope of your capabilities as a healthcare provider and your assignment will ensure that you have liability coverage. Because you are a volunteer, we are unable to provide workers' compensation benefits. We take it very seriously to ensure your safety. If you see something that you are concerned about, please immediately contact your supervisor or the safety officer that is there at the event where you are participating in. Now, that's your access to information about our clients and patients, but we also take the security of your information seriously as well. So in the Virginia Volunteer Health System, your information is managed by MRC Unit Coordinators, emergency coordinators, our Virginia MRC administrative staff, Megan, Laura, Carrie, you might have talked to one of them. We all manage this huge amount of records for all the volunteers, so we have access to that. We provide your information to health department staff. They want to know, how many vaccinators do I have that could come and help us for this clinic next Thursday? And so we would provide that information to them so they could use it for planning. And when you registered as a volunteer, you agreed to allow us to share your information only as necessary. So we do that as needed. And let's talk a little bit about the backbone, the backbone for all of our electronic communication and credentialing and tracking, which is the Virginia Volunteer Health System. It's used by our local MRC Unit Coordinators, health districts, and our admin team to help mobilize volunteers for all MRC missions. And you should have already gone to our website and filled out this application. Now, here's one of the most important things. If you've filled out this application before, you don't need to go over here and click on this register as a new volunteer button. Enter in your login information on the right-hand side where it says, please sign in. If for some reason you forget your username or your password, you can click the trouble logging in button and it'll allow you to reset your password and send your username to you. For some reason, maybe your email address has been changed since then and you still need help, click on the contact us button and you'll be contacting our admin team, and we'd be happy to help you in resetting any of your account information in the Virginia Volunteer Health System. Now, once you log in as a volunteer, you're going to get to see your own home page. And this will give you access to information about your account in the Virginia Volunteer Health System and to change information. So for the moment, I'm going to focus on how to change information. If you come over to the right-hand side and click the My Account button, you are going to get the opportunity to change any of the information in the application that you submitted, which you still have access to. This is accessible to you if you have an approved or a working or an incomplete application. If you've submitted your application and we're in the process of reviewing it and you try to log in, you will not be able to go in and change your information. But if you're in the other statuses, you should be able to go in. So anywhere in the application where you can make changes, there's an edit button on the top right-hand corner. You can click that edit button and it'll open up the fields that you have access to. As you can see, this application is for my very handsome therapy dog, Zeus. He would like to help alleviate any stress at all mass vaccination efforts. I would really love to, but he can't do that. But he's a great model for a volunteer profile. So you can come in and change your email address. We really encourage you that if you have a .edu address affiliated with your student status or a GOV, a government account, that you provide an alternative email address. Sometimes those accounts have very strict restrictions on email filters, and those emails might accidentally get blocked. So having a primary and secondary email is recommended in that case. We would love for you to be able to select the picture that's used on your badge. And we wanted to show you what are some good examples and not so good examples of a badge picture. So all the way over to the left with the adorable girl and Zeus is not a good picture because you have to be able to see just you. The picture in the middle is nice, but there's a lot of background and we really need a solid background. So the picture over there with the star, you know, you're looking forward, you've got a solid background, you got a smile on your face. So if you didn't upload a picture, please log back into your application in VVHS. Hey, get a friend, get your husband, take a picture of you standing against a solid wall and upload it in VVHS. You can come into your profile, hit the select image button and upload it. If you have any problems, no worries. Feel free to email our vamrc@vdh.virginia.gov account, and Carrie or Laura will be happy to upload the pictures for you if you have any problems. Remember I talked about contact information? Just since I've started 39 minutes ago, I've gotten 3 alert messages to volunteers for deploying to COVID-related events and probably for vaccination efforts. And keeping your information updated on this page is how you're going to be notified. So make sure that you entered in your cell phone number, and if possible, we really recommend that we can send a phone and text message to you. Sometimes emails get accidentally put in junk and spam filters, and there's really not much that we can do about it. But text messages always seem to go through. So without a doubt, a phone call and a text message works. So please make sure that if you're willing, you indicate the option to do that. It's not necessary to have 2 phone numbers. One with both options is perfectly acceptable, and you can update that information at any time. In the credentials section, you can upload pictures of your identification. And this is important because if we have an official identification for you, such as a driver's license, passport, some government issued ID, military ID, and we have your headshot and the 2 match, then we are able to run a background investigation on you without having to contact you. And that just moves you one step faster into becoming a deployable volunteer. So same thing as your profile picture. It doesn't have to be anything scanned. You can put that document on the table and take a picture with your cell phone. That is perfectly fine, just as long as we have some document of it. And again, you can upload that as well. In the credentials section, if you're a healthcare provider, we ask that you include your license information with the Department of Health Professions. Make sure that you do select Virginia Department of Health Professions in the issuing organization. And if your license number in the issuing organization and your first name and last name match, then your information automatically gets validated with a new data set every evening from the Department of Health Professions. We track CPR certifications. A CPR certification is a requirement for our vaccinators. I'll talk about that in just a minute. But please upload any certifications that you have regarding life support. We also have the ability to upload the pharmacist immunization certification in here as well. So upload that into the certification section. All right, we got the documentation done. We review it. We say, oh, she is a great pharmacist. We are really going to need her to help us provide vaccinations. And oh, if we have to mix, I really hope we don't have to do any mixing of vaccine. Moderna and one would be great. But if we need to, pharmacists and our physicians, our higher licensed healthcare providers will be essential in doing that. So if we go through all this, you've had your orientation, check that off. You've done that today. We've got all your credential stuff in here, check that off, your background investigations. We'll move you to a deployable level and you can respond. And you know, how you're placed in positions are going to be dependent upon those credentials and your training. And we have a very robust learning management system called Train Virginia, and it's designed to support our public health workforce and you as MRC volunteers for training. And all of our online training, recorded training, is posted on Train Virginia. You have the opportunity to take whatever courses are on Train that might benefit you, either professionally or maybe academically. Some of those courses do have contact hours or CEUs provided to them. You'll need to look in the course description. And VDH, we don't facilitate that. That's according to the course providers. You will always have access to your Train records, and actually you can't go through Train. I need to remove that because we had to disable it, but you cannot go to Train from VBHS or VBHS to Train. But once your account is approved in VBHS, you do not need to create a Train account because we are creating one for you. We have on our training page off of our Virginia MRC pages, a step-by-step how you can log in when your account is created, how you can get your password, and then also access to our wonderful train administrator, Brad, or one of the other super users that'll be able to assist you. Thought I'd include a snapshot just of what it looks like in train. When you've logged in, this is the screen that you'll see, and there's some announcements. If we give you a train course ID number, and you'll see that in a lot of the descriptions, to search for it, you come up here to this little search button, and you click on it, it opens up and you can just type the course in and that'll automatically take you to the course. Although in many of the online listings that we'll have on the website, you can just click on the name of the course and it'll automatically take you to the course and train. And in order to access it, you'll need to log in if you're not already logged in at the time of which you click that link. So that's just kind of what the landing page looks like. So you're familiar, but you'll have access to those courses. Now, right now, we've kind of streamlined and somewhat minimized our typical training requirements. We usually have like disaster preparedness, emergency preparedness 101, psychological first aid. Now, I really encourage everybody to take psychological first aid, but we are providing a mass vaccination overview for COVID-19. And that's actually taught by Megan and Lena Abdulaziz. And it's just an overview of point of dispensing and what will that look like in a COVID environment? What are the considerations and changes, plans that have been put in place to be able to allow us to effectively and efficiently mobilize volunteers and public health staff to put COVID-19 vaccinations in people's arms, which will make all of us very happy because it is truly the light at the end of this COVID tunnel. It's not a required course. It's for your information, highly recommended. If you've taken a point of dispensing training previously, you don't have to take this one, but most of our volunteers find it very, very useful and important. So we encourage you. We are providing an incident command overview, ICS overview. It's not the FEMA course. We are providing that on January 9th in our training blitz. So it'll be on a Saturday morning. Or there is a FEMA ICS online course. And whether or not that's recommended or required is going to be based upon your MRC unit. I know that Fairfax is requiring ICS and National Incident Management System 700 for volunteers, and Paula will provide information to you when you sign up and give you instructions on how to do that. We do have vaccinator training requirements, credential verification for vaccinators. So we just posted a web page when a MRC coordinator identifies that you're interested in being a vaccinator, they will share that information with you. One of the pieces of training that is required is our American Heart Association online CPR training. So we're doing the didactic version of the healthcare provider American Heart Association training, but because of the increase in COVID cases, we are not conducting in-person skills assessments this time. So only the didactic is required. You must have that current certification, and we have a scholarship. So completing the American Heart Association course is provided to you free, and you can submit a request to get a scholarship. It'll be approved and you'll receive communication on how to go online and take that course. Will Sanford is our lead in the MRC team, who's the coordinator for all CPR courses, and he'll work with you on that if you're a healthcare provider. Our base landing page for training is the website that's seen here. Scroll down to the bottom. There's a couple of pop-out accordion menus. You can peruse the other courses, the psychological first aid, the links to the 100 and 700 courses are all there. So use that as your base landing page when you're looking at completing any type of training related to your MRC service. in VBHS, when you log in, over to the left-hand side, you went in previously and went and looked at your account, but if you came over and clicked on training records, you would have access to download a report that would show all the training that you've completed. This may be helpful for you if you're a student and you would like to document that you've completed specific courses, or you're asking for some contact hours. You have access to all your MRC training here. You click on the download report button, and it will give you a breakdown of the training event, the course format, the training start date, and they'll give you all the information that you've completed for the courses you've provided. So that's for your use. Let's talk about, once you got the training now, how do you get moving? How do you get out in the field to do the great work which you've signed up to do? We activate volunteers based upon the requests that we receive. So not all the time are we going to need everyone. We will selectively send out alerts to the volunteers that are needed based upon those requests. So you'll be contacted through the Virginia Volunteer Health System, and potentially additional information could be sent to you by the MRC Unit Coordinator, your site supervisor. We've been mobilizing volunteers to support hospitals or long-term care facilities, and then they're being coordinated by someone at that facility. So you'll get initial communication and follow-up deployment instructions. So our alert notifications are sent for all different types of events. And that could be for community outreach. And we have some classifications, kind of headers that come on in the subject that will give you a little bit of an idea about what the alert's about. We have communication, typically, that's a newsletter. An awareness is just, hey, it's hurricane season, please be prepared. Readiness is we are developing a team of volunteers to support vaccination efforts. If you are a licensed healthcare professional that would be interested in volunteering, please click available. Activation is you're now on that team and we have a vaccination event to go to next week. Are you available? Click on the schedule. We send an emergency if we need volunteers within less of a 24-hour period. We usually send an alert, an emergency alert that might be for setting up a shelter or maybe an emergency testing event. And then a deactivation is a stand down. You're no longer needed for that mission of which you were alerted about. You will receive a unique email for you to your email address. And it'll have a little bit of a summary about what the alert is about. When you click on the link, there is a pop-up that comes up and tells you more detailed about the who, what, when, where, how, additional information that you need in order to respond to whatever you're being asked to do. So here's Fairfax Health Department wants to know, can you show up for orientation? If you are available for this event, you would go down and click, I'm available for this event. If you are not available for the event, you would go in and click the red, I'm not available for the event. So that's really simple because it's just a yes or no. As we really move further into this vaccination campaign, we will more than likely be sending out alerts that have multiple locations and multiple times and shifts and multiple roles. To please read them carefully, and you can choose to select all of them, one of them, 2 or 3 of them that you're available for. So you would click in the available boxes right here, and if you said, hey, I could do both of these, you would click the I'm available for the selected event button. If you can't do any of them, you click the red button. So it's pretty simple. That really cuts down on all of the time that would be necessary for us to call you and send individual emails back and forth. We try to be really smart with our time and provide the information that's needed to help you make a decision of whether or not you can respond to the event. So other than this email, you can also potentially receive a phone call. So when you get the phone call, All right, you're allowed to take out your phone now. Everybody, get out your cell phone, or if you don't have your cell phone available, which I'd be shocked because I have two in front of me right here. Take a sheet of paper, write this phone number down, 804-864-7200, and save it in your contacts as MRC alert. When you receive a phone call, if it's for a simple yes or no, it'll allow you to select 1 for available or 2 for unavailable. But if we have like 6 or 7 responses, you will not be able to select your availability for them. However, you can, it'll tell you to go back and check your email to select availability. In addition to email, for some reason, that email got into the junk mail, you can always go into VDHS and check your alerts. And when you log in on your dashboard, it will list all the recent alerts that you were sent. And you could click on any of those links and it would take you to the alert and you can respond right there. So remember, logging back into VDHS, you can respond to your alerts, you can get your training report, and I didn't even go over it, but you can also download documentation of all the events that you've supported using the deployment report function. So please remember that VDHS is our tool to communicate with you and maintain all your information. If you ever need help, reach out to our admin team to be able to assist you in using VDHS. They would be happy to provide any support that you're needed. So that was a lot we've gone through: credentialing and VDHS and training done, and you got the alert and you want to go, right? Oh, this is everything you signed up for. I am so excited. I'm ready. Here, pick me. I know that many of you are very, very eager. So make sure when you do say available that you read through that alert and make sure that you're qualified. If potentially we need people to do line flow and it would require you to stand for 6 hours, and maybe you hurt your knee last week and probably standing for 6 hours may not be the wisest thing. You might want to opt out of that position and maybe see if there's a position that maybe is a little bit more sedentary and sitting down at a table and talking to people. So make sure you're physically capable of providing support, that you're emotionally ready, you're, kind of like pumped up, that if you have things that are going on really hectic in your life, don't feel obligated. I mean, we want you to have a great volunteer experience, for you to be able to interact and support the public and work well as a team with our MRC, your other MRC volunteers and our other staff at VDH and our partners. So just be ready to make that commitment and be a part of the team. And not everyone is perfect for every request, and that is okay. If you haven't given or done a specific task in a long period of time, and you don't feel comfortable with that, then you don't have to respond as you being available for it. If you have any questions, you can always ask whoever mobilized you or sent you the alert in VDHS, and they can tell you if you could be assigned perhaps to a different position. We are all mindful that we are operating in a COVID environment, and there are, of course, risks for all of us personally. If you are in a higher risk category, they've no longer said it's a specific age, it's older or with health conditions, you might want to consider your willingness or your ability to serve in some of those positions based upon that. We do have some virtual positions, maybe contact tracing virtually would be a great fit for you. It's up for you to decide if the position is too high risk for you. We can't make that decision for you. But we will make sure that you have PPE according to CDC guidance, and make sure all the protocols are followed so that we prevent you from getting COVID-19. We will, when volunteers are supporting vaccination events, when they're engaged in public-facing, interacting positions, provide volunteers with COVID-19 vaccination for the 1A category. And Megan and Lean will talk about that a little bit more in the COVID-19 mass vaccination overview. So just be mindful. It's your responsibility to assess your health and your ability to serve. And please know that it is okay to say no. We don't expect you to be available for every single alert that comes out. We have a lot of stuff going on, and we're blessed to have a tremendous amount of volunteers. So we hope by having a large pool of volunteers that we'll all be able to fill the gaps whenever we are available. And so be ready to go when you're called if you're available. And when you go, know that you are a volunteer. I mean, you're serving your community. We don't provide, any monetary support to volunteers. Now, sometimes our volunteers have become such integrated and valuable members of the health department that when contract staffing options were made available, volunteers immediately filled those options. That'll be, if that happens, trust me, we'll open up those positions for you. But, when you're an MRC volunteer, you are a volunteer. Always represent the MRC, wear your identification badge, your MRC shirt, whatever apparel that is provided to you as for safety purposes. Make sure you dress warmly. No one's gonna be wearing sandals this time of the year, but in the summer we say don't wear sandals. Wear tennis shoes, comfortable shoes, all of that to make sure that you take care of yourself. Sometimes we'll provide in the instructions if we're providing food, beverages, that kind of thing. We do that, try to do that, but it's not sometimes always accessible, so we definitely will let you know. Provide those directions on signing in and signing out. It is really important that we know that you're there and when you've left, not just to document hours, but for safety purposes, to know if something were to happen, who we should account for. So make sure we know that you're there. Some of the unit coordinators are using an electronic version for signing in and signing out. So it might be a Google survey that is text to you, and it says please check in and click this survey, and then you type in your information in the survey to check in, and you type in your information in the survey to check out at the end of the day. It might be an in-person sign-in sheet. It'll be deployment dependent. You should be provided with job action sheets and a description of what your position is, and perhaps some just-in-time training, learning about how to use the specific needle and sharps container that they have at the event, or reviewing the forms that the community members are having to sign. You will receive some just-in-time training. And wear the appropriately provided and fit-tested PPE. Best laid plans. COVID changes every day with every email, and sometimes multiple times a day. We have been constantly flexing, learning, adapting, mobilizing, with standing by, really all of those things. It's tiring for a lot of us, but it is really rewarding work. And just know that I know you signed up and you're super excited right now. You might be on, I would say, the B string of vaccinators, because we've been onboarding vaccinators since March. So we're probably going to start using the people we already had onboarding, and you're going to be a part of maybe the B team, so the 1B team or the 2 team. So we're gonna need a long team for our vaccination response, because it's going to go until maybe June. We'll see how quickly the vaccine comes out and how successful we are in providing it out to the community. So always Semper Gumbi, be flexible. There's a lot of benefits to being an MRC volunteer. I can tell you, I really hope that you enjoy your service opportunities as an MRC volunteer. I've seen so many great stories of retired nurses talking to medical students, and two nurses that hadn't seen each other, and all of a sudden they show up at an event together and like, oh my gosh, I haven't seen you in years. Husband-wife teams volunteer together. Maybe he's a pharmacist and she was a librarian, and they volunteered to be at events together. Whatever it is, I think you'll find that you will have made some really lifelong, wonderful relationships, and really know that you've made a great difference in your community and keeping it healthier, safer, and improving the overall health of your community as your service as a Medical Reserve Corps volunteer. So we ask a couple things. I don't have a summary slide. These are the things I don't want you to forget. You represent VDH and the Medical Reserve Corps. So always take that as pretty serious that we chose you and you chose to join us. You will be activated when you're needed, so don't go unless you're asked. Respond to those alerts in VBHS, either text message, phone. Well, you can't respond via text message, but you'll get a text message. So you can respond via phone, via email, or you can log into VBHS. Only talk to the media if it's coordinated by your coordinator or a public information officer. Get into train with the account that's created for you and be on standby for deployment. So what's next? If your application isn't approved, we'll go ahead and get that finished being processed. Background investigations, if it hasn't been done, we're working on that. Soon as we get those two things together, we'll work on issuing you identification, your badge and your lanyard. So we'll coordinate with you of picking up your badge, your lanyard, your shirt. We do that in a drive-through model. Often we'll have a identification dispensing day on a Saturday, and you'll drive through and pick up your badge and your shirt, meet your MRC coordinator and a couple other volunteers. Complete any online training that's necessary. Be ready to be mobilized and demobilized. That's a lot of content, which I covered in an hour and 10 minutes or so, which, wow, I was moving pretty quick today. So before you go, I need to make sure that we know that you are here. We created a website to take roll call. So you can go to our website, MRC/roll call. And on there, it says, click here to confirm that you attended a training. Now, the secret phrase for orientation is Virginia MRC Rocks. So VA MRC Rocks is the secret phrase that you'll need to enter in that form in order to confirm that you participated in an orientation. So please do that so that you can get that check off in your box in the Virginia Volunteer Health System, and we can move you along in the deployable volunteer process. More than anything, on behalf of our governor, state health commissioner, all of the staff of the Virginia Department of Health, we thank you so much for coming alongside us, stepping up and serving your community in this COVID-19 pandemic. We can't do it without you, and we are grateful and amazed, astounded by everything the volunteers have done before you. And I just know there's going to be another 200 hours of volunteer service provided to the Commonwealth in this vaccination effort. It is going to be unprecedented, and we look forward to serving with you and helping to protect the health of Virginia. And thank you for spending your time today, your lunch hour, taking a break and becoming a newly oriented Medical Reserve Corps volunteer. I'm finished with orientation now, but Megan, feel free, if there are any questions in the chat box that I didn't answer, I would be happy to take those now.
Hey, Jennifer, thank you so much. Let me go to and pull up my page. I just have a few questions. There were some questions about after you fill out, after they attend their online orientation today through the training, what the next step is. So what would be your recommendation for their very next step?
Probably to wait, because your coordinator will be doing your background investigation. Once your background investigation is done, and you've completed the orientation, then they'll move you to a deployable status and get your badge printed. So really, the next step is to make sure your pictures are in VBHS. Otherwise, it's kind of stand by and wait. And you can go ahead and take some of the training that's on our training page. The ones that I listed in the orientation, and the ICS overview and the mass vaccination overview, they don't require registration, so you can just click on them and join us on the days that's listed on our training calendar.
Great, thank you. And then there was some additional questions about what all needs to be completed before being deployed. I know you covered this a little bit, but if you could kind of give a very quick summary.
So the orientation, the ICS 100 or FEMA ICS and National Incident Management System, that's dependent upon your MRC Unit Coordinator. Once your application is approved, not too long after that, you should receive a welcome email from your unit coordinator with specifics on what additional things they need for you to do. So I would just say, wait for that email and follow up with their instructions.
And then I think one of our last questions was there were some questions about the level 3 for volunteers, and then also some questions about what ESAR VIPs mean.
All right, so MRC levels that we mentioned, being right now you're level 4, okay, because you haven't completed orientation. So a level 3 is a deployable volunteer. So that means orientation, it means a background investigation, verifying credentials. And when we get those things, then we move you into the deployable status and we get you a badge. So that's deployable. ESAR VIP, Emergency System for the Advanced Registration of Volunteer Health Professionals / medical levels, is a federal designation of how we resource type healthcare professionals. So if you do not have a current license, but yet you were previously licensed, you're an medical ESAR VIP level 4. If you're a student, you have some type of medical background, you're a level 4. Now, let me just add as a note, if you are a healthcare provider and your license is inactive, through the Department of Health Professions, both the Board of Medicine and Nursing are allowing people to reactivate their license without any fees or continuing education units. So please go to the DHP website and you can reactivate your license. So that would be a level 4. If you have a current license and you're not currently working, you're unemployed, or you're working in a setting that's not a healthcare setting, you would be a level 3. A level 2 volunteer is, we've got confirmation that the person is actively working as a healthcare provider in a clinic and an urgent care center, primary care provider. They're working actively. A level 1 is that they are employed by a hospital and working in a hospital setting. I'm going to put that down to include in the next orientation, the definitions of MRC and ESAR VIP.
And I think that's most of the questions. I know that there was also some questions regarding whether or not you could vaccinate and things like that. I'm going to go ahead and put that training in the chat for you guys to review our mass vaccination training. It was recorded. I've put it in there a couple of times, but I'll put it one more time. But a lot of those questions that are specific to vaccination, I did not answer because they would be answered in that training. So I'll be putting that in the chat just so everybody is aware. But I think that gets most of our questions today.
Okay, and Megan and Laura and Megan and Lean do a great job with that. It's recorded, but when they teach it again on the 23rd, if you want to wait until the 23rd, they're always updating the content. So probably have even better content on the 23rd. Just want to plug that, but feel free to watch the recording, either or. So thank you, everyone. We hope that you had a great day and that this was helpful. Feel free to email us if you have any other questions. We'd be happy to help you, and thank you for volunteering.